Thank you. Oh my God, just started a presentation for, she has been in IT for over 25 years. It's really spooky. It's like I told my son that put away your pad. You know, in my childhood, we didn't have iPads. And he was like, you remember dinosaurs, right? So it feels approximately the same. But okay. Welcome to the lecture of the eHealth Dinosaur. And actually, someone probably has heard it before, so I will try to make some new points, but still talk about e-health strategy in Estonia. Because it's, I think, quite a big thing that we have the common strategy, which was compiled together with the private sector, with public sector, with all the stakeholders, and it's kind of common direction where to head. So this year, February, the e-health strategy was signed by the Minister Sikkut. Now we have Minister Joller, but she still vouches for that strategy, and I'm very happy that she was actually introduced the strategy even before she became a minister. So we still all aligned despite all the hectic times in politics. But why the strategy is so important? Because we decided to compile all the common goals, meaning that we started with asking the private sector, the researchers, our institutions of what is the biggest pain point that you want to solve with this strategy, meaning what is the biggest challenge, that we cannot definitely do everything because of limited resources, limited of time, limited people, limited budget, as you can notice. So we have to prioritize somehow that what do we do, and also what we don't do, because it's also important that we cannot handle everything. So let's choose the pain points and try to solve them together. So we compiled all the kind of pain points from our stakeholders, as well as had an input from our different welfare development strategy and digital agenda, and all the overarching documents, and tried to compile first what are the priority directions, but then it was the biggest actually challenge was to find the common mission or vision, that what is the big picture? Meaning that yes, sure, we have to do all these little things, so we have to be more digital, we have to get data exchange fast and so on, but what is the kind of big goal? As you know, we have this tiger leap, and we ask that how the tiger would leap another time, or what is the biggest breakthrough, basically, not just these tiny small things, but where does the breakthrough come from? And I'm very happy actually that we were also commonly aligned that AI is probably the new enabler for the breakthrough. Not a new technology, because we've seen many technologies like blockchains and so on, all the buzzwords and so on, but implementing AI in different processes, in different solutions, I truly believe, or I'm this AI evangelist who believes that it will really extend and expand human capacities, meaning that it can enable so much more that the human eye doesn't really meet. All the AI already used in radiology, in preventive care, in predictive care. We will have first solutions out based on genomic data using AI. So we have already our solution providers here also. I will not name them again because I kind of feel like a promoter for private sector already. But still, for example, the decision support for doctors, for drug interaction, AI/ML components. So it's already there, but I think it's just the beginning of an era. So it will be much, much more. And it's very exciting to see how we can implement it in our priority directions, which are person-centered healthcare, supporting healthcare specialists, as well as improving always the quality of health data. But then again, to concentrate on these pillars, we need to have the foundation in place, agile and supportive. So the foundation is definitely that we need to have the UPTIs as we envisioned it, meaning that agile, fast, getting services out, not in microseconds, but in micromonths, data moving real time. And yes, of course, it's a challenge because still very strange to hear, but Estonia is not a new kid in the block anymore. We're already a legacy country, which means so many systems to replace, to patch, and the new technology that is there. Our old base doesn't enable it anymore. So, when I came and Finland was like, yeah, we're going to teach you how to live. And we were like, no, we know the innovation, we're the new kids. So now the Ukraine comes and says, we're going to teach you how to live. And we're like, yeah, we have legacy. We have to patch our old systems. And then we will be the uprunners again. So, but anyways, patching the whole systems to enable the new breakthrough based on the FIRE and other standards we will be talking today. But of course, in parallel to cybersecurity, it's becoming more and more challenged with our great imperialistic neighbor waging the cyber war. We experienced it first time in 2007. Yes, dinosaurs still remember that, when it was said that it's the first in the world cyber war against Estonia, but nothing has changed. The allies of Ukraine and Western countries still face cyber attacks, and I think it will increase the range and the scope. We've been, to a certain extent, lucky, to a very big extent also professional in regards to securing our systems, but they need more and more attention. I hope also, last time when I said that, someone asked me from the audience that, what are you doing to secure your healthcare information systems? And I'm like, yes, but they come from private markets, so actually it's a RIA. By the way, who are you? I'm the head of RIA. So I hope we will also be cooperating much more with RIA to secure also private market solutions, because still we as a TEHIK and we as a Ministry of Social Affairs have a certain responsibilities in regards to cybersecurity, but there are many other authorities also that need to collaborate, cooperate to keep the private market safe and educated as well. So, and then we found ourselves in being in European Union, which means that all the European regulations also have to be implemented in Estonia. And with each and new year, new regulation is basically there, which we have to implement. So first it was MDR, bringing lots of responsibilities to companies. Then EHDS, European Health Data Space, which came into force in March, which means it's the beginning of the journey. Then we have AI Act, still trying to figure out how much burden it will bring to companies. Actually, European Digital Agency counted that it's going to be 200 to 300,000 euros just to comply with the EA Act, just to use AI. Anyways, so still burden after burden, and we found ourselves in a situation where we have to deregulate ourselves, which means that first we have the regulations, and then we face the challenge how to sandbox it all. So now we're trying to figure out how to create this supportive and innovation-oriented legal space, which means that we're working with Accelerate Estonia and with the Ministry of Digitalization and Justice to find out what they mean by sandboxes. That what can we deregulate, what law can we cancel at least temporarily. It's an interesting situation, right? So anyways, by creating this basis, we hope that we can concentrate on these three pillars, which are person-centered healthcare, which couldn't mean anything, I will tell you in more details. Supporting specialists in healthcare, which means doctors, nurses, and all the personnel that is participating in health and care as well. And definitely the high-quality data, meaning that when we asked our different stakeholders that what is the priority and what is the main pain point, then basically everyone responded that we need high-quality, rich data, not depending on whether they were working as healthcare professionals or in private sector. The healthcare professionals want for decision-making the high-quality data, preferably in real time. The research and development companies want to have access to secondary data as fast as possible. We as a policymakers want to have the on-time data for decision-making, for decision-based solutions, for planning our finances and so on. So not depending on whom we asked, it was still about high-quality data. So first pillar, yes, is the person-centered healthcare, which means that we want to concentrate on all the different solutions that help to provide personalized, predictive, preventive care. That means based on your life events as well as on your health data, which means exciting times of combining all the DNA and health summary data to give personalized advice and the screenings and so on. And as well, we're starting to integrate the social and healthcare data into one care plan, which is extremely important that the health data would not be only used by healthcare professionals, but also by social care professionals, so that we can offer the integrated care, not only health, but integrated care. That means that when the healthcare and the social care workers have to support one patient, let's say elderly patient at home, then they need an access to offer this high quality care. And we have first pilots hopefully out in 2 years, which means piloting the first collaborative environment for health and social care workers based on person's consent. Definitely, our healthcare workers are the biggest asset, and they don't have enough time, resources. We don't have enough healthcare professionals, as you know, the doctors, the nurses, to offer the care we would want to. That means that we need to support them in any and every way, and digital tools definitely can save time on all this unnecessary bureaucracy still, as well as offer this decision support and different tools to make, again, informed decisions and give informed recommendations. And AI will not replace the healthcare professional, which is very important, but it can be a support system or recommendation mechanism, or fill in all the documentation, or plan different work schedules, or do so much more so that the doctors can concentrate on their main task, helping the patients. So any and every solution that helps to decrease the burden on healthcare professionals is definitely a priority as well. And again, also healthcare specialists said, we need data, we need real-time data. For example, when our patient, the family doctor's patient, is somewhere in emergency, they need to know, not after the hospital discharge report is closed, but they need to know now that their patient is in ambulance or in emergency, because they need to plan their time, they need to plan the aftercare, maybe they need to plan the work of social care worker and so on. So also it's extremely important what we're talking about today, to have this data not only in high quality, but moving as fast as possible. And yes, definitely. Today you're going to talk a lot about the data standards that we need to standardize. We need to minimize this kind of free text, anything and everything format. We need to stick to this once-only principle for patients as well as for in healthcare system, that we won't be duplicating the same data in different places and asking for the same statistics from this different places. And what is also important, I think, is access to the secondary data. And here we collaborate with the Ministry of Digi, Ministry of Justice and Digitalization, as well as Ministry of Economics, to create this one concept of the access to secondary data. European health data space is only the first data space that is out there. There will be like 13, 14 different data spaces, and we're kind of pioneer, and it's very strange to pioneer in the most challenging sector, healthcare, but we are. So the next data spaces will be facing the same issues that we are. Basically, how to make secondary data available as fast as possible so that it could be used for research, for development, and how to actually not send out the data just unprotected somewhere, but how to make it available and accessible in a safe processing environment. So we teamed up with the Ministry of, as I said, DigiJust, and we decided that maybe we can simplify the secondary data access and availability process. So today, you know better than me, this twisted picture about how you apply for data. Let's say, for example, that you need data not only from Ministry of Healthcare, but you need also from Ministry of internal affairs, the population register, maybe some data from the Ministry of Education or Ministry of Climate and so on. So you have to apply for this data for several different ministries or organizations. Parallel processes of data permits, maybe ethics committees, and by the time you get this data, you kind of maybe don't need it anymore because it took such a long time. So how to make the process simpler, or how to make it less painful? We very much hope that we can create this one environment. At this moment, it looks like it's going to be under the Ministry of Statistics, where we will have one data access application management, which means that the scientist or the IT company that needs the data would need to apply from only one place by one application. That, for example, they can choose from data catalog that I need these kind of data sets from the healthcare, this kind of data sets from social care, from population registry, and it's just filling in one application. The information will be sent to ministries, authorities who have the data. They will give their permit definitely if they can give out the data. How fast they can give out the data, what is the data quality. We will have the data quality framework and labeling as well, so that the applier would know what data he's getting. And then the applier would know from one centralized management system as well that how fast he will get from whom what data to plan better the research. And this should save a lot of time, that you don't have to really hassle between these different data protection authorities, different application points, different application systems. And then in ideal case, we would have this data already high quality somewhere in the warehouse, and we could put it into secure processing environment, basically ASAP, which means as soon as we get the permits and as soon as we can make it available. Of course, we don't have like all the data now in the warehouse with the highest quality possible, very rich and so on, but it's constant process. I don't think any country can say that we have all the data structured, rich, available per tomorrow. Extremely big challenge is basically that we should respond to the data requests based on European health data space in 3 months, which is like magic, actually. We hope the magic will happen also by optimizing all these processes. And we're working now on the data catalog in TEHIK, we're working in the data quality framework, we're working in the centralized application management system with the Statistics Bureau as well as DigiJust. And we're defining what is a secure processing environment, which means that what is secure enough and what the processing environment should enable. For example, you can install different tools to model AI, to do anything you need, but you cannot withdraw the data because this is why it's secure, basically. And we would like to do the first pilots also with Finland in cross-border secondary data exchange, which means taking Estonian data and Finnish data, the simply where it's like unified or in the same format pretty much, and to place it in secure processing environment, whether it's going to be Estonian TEHIK or SAPU in Tartu University or Finnish Kapseli, to try to combine also cross-border secondary data, because I think it will really extend also the number of high-quality data sets. And for example, for rare diseases or for any kind of untypical situations or information needed, it would be important to have as much data as possible, as much as possible high-quality data again, because we have data, but high-quality data. So we're working on this vision right now, and it's, I wouldn't say it's a long way to go, but I hope we will have now the kind of political consent that everyone sees that we should have it nationwide, because otherwise we would have lots of small, this kind of same processing environments and different application managements. So far, so good. I think I talk about 1.5 years with the first milestones, meaning our own data catalogs and application system pilots. Then we need definitely the ministries to join in, which takes time because we cannot pressure other ministries to share the vision, but I hope we can convince, and we're working on that right now. So our e-health strategy is definitely based on data and on making data available for primary use, for secondary use, as fast as possible, in real time, standardized, high quality, all the things we're going to talk about today. But I just wanted to say that our national vision supports also very much what you're discussing today. And even with limited resources, we understand that having the high quality data is definitely one of the priorities, or actually the main priority. So despite of everything happening, I hope we will not make compromises here. And thank you very much. And I don't know if we have time for questions.
We do have time for questions. Please raise your hand if you have any questions, and my colleagues will take a mic to you.
While the mic is going somewhere, just wanted to ask, out of curiosity, who has heard about the e-health strategy before? Great, I've been doing my job.
Oh, we have a question here.
From the professional who knows everything.
Thank you, Karin Rask from TEHIK. I just wanted to ask your opinion about the what would be the biggest accelerator of using AI in healthcare, and I mean on regional or national level. Would we talk about pilots, regulations, some more action from private sector? So yeah, your opinion on that. Thank you.
This is a very cool question, because we try to analyze all the time as a private sector that what is the biggest bottleneck kind of for having applications out, because we would like to test so much more applications that are available in the market. And we actually had a AI/ML pitching day last Friday with Finland and with Latvia, where 14 companies that are using AI/ML components pitched their solutions. And when we kind of selected Estonian companies, we found out that there are not so many companies that are really using AI, that have all the medical device regulation certificates, that have passed all these AI Act requirements and processes and so on. Actually, there was 1.5. We're half joking, because yes, sure, we use AI in different solutions, kind of use. And we kind of have machine learning components, and we use the Copilot and everything else. But still, if we're talking about Estonian solutions, then it seems like the bottleneck is the long way from the idea to passing the clinical trials and having the MDRs in place, and then certainly AI Act at certain point, and then having the product out so that the healthcare providers can say that we're ready to pilot and we're ready to test, because it's corresponding to all the requirements. So I think Tervisekassa's innovative projects or pathways are different, very cool, where Tervisekassa supports the launch and the process, which means the hand-in-hand basically going through all the milestones and requirements together. But definitely we would need more also the private sector solutions there. Because again, we would like to implement and pilot, and this is why we even implemented private sector in our strategies, saying that we need input from private sector. Private sector is participant. And at certain points we have this even orange dot saying that government is not doing that. Private sector, please, please, we need telehealth solutions, we need remote diagnostics, we need different digital solutions. But again, I think the bottleneck is the long road from the pilot through all the regulations and clinical trials to having the product out so that the healthcare providers feel safe and secure to use it. But this is just my bet. But we're definitely doing our best in regards to create these AI sandboxes and to make the solutions available even before all these valleys of death have been passed.
Thank you. I think we have another question.
Thank you for a nice presentation. Ulla Ellison from Meliva. I didn't hear too much about the implementation of these nice solutions because understanding the budgetary situation, most probably private healthcare is becoming much more important. Mm-hmm. I think it's not only a question about the existing of the solution, but rather it's more how to execute it. And maybe you would comment in the light of some recent discussions, how you see that collaboration with the private healthcare service providers.
Mm-hmm. Well, I think again, still in most of the cases, government will not be programming, launching solutions, software services, different, I don't know, IT solutions, but the government should and will be staying as much as possible as a procurement office, let's say, which means that still the software solution should be created by the private market. And what we can do is rather give an input of what is priority for the government and for the actually health ecosystem, because the strategy was compiled together with ecosystem, meaning, for example, that if we say that we need digital health, or let's say telehealth solutions, then we say, yes, we support it as much as we can, but the solutions have to come from the private market. What we can do and should do is integrate them to the health portal, as well as to the healthcare workers' different tools, as we have implemented the decision-making tools, the drug interaction tools, and so on, which means that we're now working on creating the standards, how to integrate the third-party applications to the Tervise infosüsteem and tervisejuhtimise töölaud. Which means that basically European health data space sets the format and the standard on what have to correspond the private applications. For example, in what format they have to send the information. There will be a conformity assessment on who can actually be integrated into the TIS or health information system. It's going to take 2 years because it's again European standard and there's lots of discussions about it. But yes, in most of the cases, in very most of the cases, the private market should be making the solutions and integrating the solutions that are ready only in regards to information exchange or data exchange, and should not overtake the private market, or should not, in most of the cases, as much as possible, there are exceptions, compete with the private market. There are overlappings, definitely at certain points, but still, the data should be integrated. Government shouldn't become a programming house.
Thank you. Unfortunately, the time is ruthless and we have to move on. Jaanika will also join some panels afterwards, so I'm sure you will hear her valuable thoughts after that. So thank you.
Thank you.